So, let's learn about the pharmacokinetics of allopurinol and learn what drug will do once it lands inside our body. Well, let's get back to our hero of story, Mr. Henry. When Mr. Henry took allopurinol, 80% of this drug is absorbed by his GIT. It does not bind with plasma proteins. Moving on, if we talk about metabolism, allopurinol metabolized in liver into its primary active metabolite, that is oxypurinol, which work on xanthine oxidase inhibition same as allopurinol. That's how it reduces uric acid levels in Mr. Henry's body. Now we will learn the difference between allopurinol drug and oxypurinol, its metabolite. As I mentioned earlier, allopurinol is a competitive inhibitor of xanthine oxidase, whereas oxypurinol is a non-competitive inhibitor. Allopurinol is a reversible inhibitor and oxypurinol is an irreversible inhibitor. Allopurinol has a short life, that is 2 hours. On the other hand, oxypurinol has a long half-life for almost 15 hours. This is why its clinical effect is much longer due to irreversible inhibition of xanthine oxidase. Here's the fun fact that we have one more name for our metabolite. It is also called as alloxanthine. So don't confuse. Alloxanthine and oxypurinol are the same. Now we talk about excretion of drug. Approximately 80% of orally ingested allopurinol is excreted in urine in the form of various metabolites, and rest 20% is excreted in feces. If we talk about the dosage of Mr. Henry, it is ideal to start with 1 dose daily. Obviously, it depends on the severity of the patient condition, but here Mr. Henry is asked to take 1 dose daily. The dose can be adjusted if the creatinine clearance is less than 50 ml per minute. Initial dosage should be 100 mg daily, which can be increased up to 300 mg according to the condition of the patient. Though it takes few weeks to show its beneficial effect, it is because it inhibits the synthesis of newly forming uric acid, and it has no effect on already forming uric acid. It takes some time to restore to the normal level. This is why allopurinol is one of the drugs that control uric acid levels and needs some time to give its activity. Apart from Mr. Henry, gout affects up to 6 million people during their lifetime. Most of them have choice of allopurinol as the first line treatment. That's all for now. Let's learn side effects of allopurinol. Stay tuned.